emphasize the title of doctor for both of you, because obviously we're in a very critical moment in Richmond's history, but the history of this country and the state as well. And today I wanted you all to help me answer some questions about the COVID-19 vaccine and options. And so that we're all on the same page, today I brought Dr. Avula, who's the director of the Richmond City and Henrico County Health Departments. He's a public health physician, board certified in pediatrics and preventive medicine, and he continues to practice clinically as a pediatric hospitalist. Last year, Dr. Avula was appointed by Governor Northam to lead the state's vaccination efforts. So Dr. Avula is considered the vaccine czar for the Commonwealth of Virginia. Some say the Dr. Fauci of Virginia. And also this afternoon, I'm joined by my friend, Dr. Robert Nguyen. Dr. Nguyen is the director of the VCU Massey Cancer Center, which provides advanced cancer care, conducts groundbreaking research to discover new therapies for cancer, offers high quality education and training, and engages with the community to make advancements in cancer treatment prevention equally available to all. Dr. Nguyen is committed to community engagement and community engaged research centered on eliminating health inequities. And he has spent a lot of time since the beginning of this pandemic with the clergy, the faith community. Every Friday, right, Dr. Nguyen? Every Friday, you jump on a call with pastors from all across Central Virginia about the news regarding the vaccine, about the virus, and also the effectiveness of the vaccine as well. That's why I invited him to join us today. I want to thank you both so much for joining me here today. And as everyone here is aware, the city recently required that all employees get vaccinated against COVID-19. We did this because we care about the health and safety of our employees. We care about the health and safety of our employees' families, and we care about the health and safety of our residents that we serve. Vaccines are our way out of this pandemic. Bottom line, hard stop. We are holding 2 vaccination events to assist with this effort. First, August 12th, 9 a.m. to 4 p.m. at City Hall in that old Pat Al's location. Free vaccinations. August 17th, 1 o'clock to 4 p.m. at the 3506 North Hopkins Road site where DPW, DEC, and others are located. Leading up to these events, we wanted to ensure our employees are equipped with all the best information possible. So today I want to dive in because we only have a short period of time about some questions, Dr. Nguyen, Dr. Avula, that are just floating out there, and I wanted to see if you guys can help provide some answers to some of our fabulous employees here for the city of Richmond. So first, starting with Dr. Nguyen, and then Dr. Avula, you can take a crack at this next. Why is it so important for people to get vaccinated against COVID-19? We talk about it weekly, Dr. Avula. Dr. Nguyen, we talk about it weekly. Why is this so important, and why are we taking the steps we're taking now? Dr. Nguyen?
Yeah, appreciate that. Well, I think number one, because COVID don't really care what you think, and COVID kills. That's the most important reason. Number two, because the reality is, regardless of what you read on some internet site, the truth of the matter is, with the Delta variant being here now, the truth of the matter is the numbers don't lie. And in fact, most of us either have had an experience or know someone else or who knows someone else who's been touched by COVID-19. So bottom line is COVID-19 is here, ain't no joke, ain't no conspiracy theory, is here and it's killing people. Number two, you should be about it, because the truth of the matter is, if we keep saying that we care about other people, why would we want to bring a virus and give it to someone we love? So if we don't care about ourselves, at least we can care about others. But COVID-19 is for real and is here.
Dr. Avula.
I think the only thing I'd add is that it's not going anywhere, right? We've all got whiplash from, starting and stopping on mask guidance, on shut down of schools, on trying to figure out how to do the workplace safely again. And COVID is going to be something that we have to learn to live with for years. And vaccination is going to be the bedrock of that. It is absolutely the thing that will keep us alive and allow us collectively to move forward and learn to live with this disease.
I haven't shared this yet, And I thank you guys for answering that question for me. My mother right now today, she is 56 years old, living in the Bronx in New York, is suffering from COVID-19 right now. I've been text messaging with her for the last 24 hours. I ordered her groceries last night and this morning. And I think she may need to go to urgent care right away. She's suffering like no other, seeing some symptoms that are, I think, somewhat rare: bruising of the skin and her light sensitivity, 100-degree fever last night. And I asked my mother, did she get the vaccination? And she said, no, she did not get vaccinated. And so I'm dealing with this in my family, but I believe that our city employees are an extension of my family. And that's why I'm encouraging that you all make the right decision and go get this vaccine. But Dr. Avula, I hear a lot of misinformation out there, and this question comes from that. The COVID-19 vaccines were developed faster than most other vaccines. And so folks say, how do I know they are safe and effective? It happened so quickly. What do you say to that?
Yeah, I think the timeline of COVID being introduced in the United States, January, February of 2020, and then us having a vaccine ready to roll out within a year really bothered a lot of people. They were like, how can we make a new vaccine for a new disease? I think what people miss is that this vaccine wasn't just something that originated from nothing, that there are 20 years of vaccine technology that this has really been built on. And so you look back to the beginning of adenovector viruses and the building of the mRNA platform, which are the technical terms for the way this vaccine is built. But know that scientists have really been working through this for almost 20 years. And we've had different attempts and with varying degrees of success. And frankly, we're lucky that this attempt with this particular virus has been as successful as it has been. We really haven't seen anything like it.
Now, when I'm walking neighborhoods, when I'm talking to friends, sometimes talking to families, there's a lot of myths around this vaccine. And I'm going to ask both of you all to sort of dispel some of those myths. And so I'm asking, can you both dispel some of the myths we have heard about that vaccine? For example, I've heard this one before, that the vaccine will alter my DNA, or it will allow the government to track me because it's installing some sort of chip. And also I heard one the other day that said that the vaccine is injecting HIV into people. Yeah. And Dr. Nguyen, you've been on the front lines of fighting HIV in your past life. Can you just help me dispel some of these myths?
So yeah, I'm gonna come raw at you. So for those who know Wu-Tang, I'm coming at you for real raw. Quit playing. The truth of the matter is, you got a cell phone. If you got your cell phone on or off and you sleep with it at night, they know where you at. So quit acting like the microchip. Why would you put a microchip for what? And I had to tell one of my people the other week, you that important that the government got to put a microchip? Quit playing, right? Quit playing. The next thing, giving you HIV. Okay, understood that, except for the fact that we now have how many millions and millions of people that have been tested and given COVID? There ain't no HIV in sight. We know what that looks like. So unless you're a medical professional, sometimes I don't give any hints to beauticians or the barbers because I ain't one. I might have read some stuff on the internet, but I ain't trying to actually mess with nobody fade. But it's amazing that we got so much information from people, right, coming from crazy sources that we internalize. Now, why? I'm going to take a little bit of responsibility on this one. It says, as a health profession, we should have been more consistent with our messages. We should have been more accessible before we hit COVID so that we built up that trust. This is a result, in part, of our health centers, like mine, not always being in the weeds, in the neighborhoods, consistently giving out good information. But here's what I won't accept: crazy information. This microchips put in HIV. That's how. Come on, they already know where you. Listen, if you government they already know where you at. So what they gonna put a microchip in you for? Use our logic. All I'm asking people is, I understand you're getting bombarded with lots of things, but the one thing the gifts we've gotten from above was the ability to think critically, observe what's going on around you. Ask people who've gotten the COVID vaccine, are they growing a tail and horns? They're not. All I'm asking is for common sense and for some critical thinking, because we need it now more than ever. Yeah, I know that was a little bit Brooklyn coming out of there, but I'm sorry.
No, that's okay. That's okay. Sometimes you need a little Brooklyn and Richmond sometimes. Dr. Avula, can you? Yeah.
I'll take one or two. You know, one that we hear very often and particularly impacts parents and younger people is the connection with infertility. And I want to tell you where that came from and why it really took hold. So there was a researcher who in the early stages of COVID, as people were learning about this spike protein. So all y'all have seen the ball, like the picture of the COVID virus, right? The ball with the little spikes coming out of it. And that spike protein is what the vaccine has been built around. The vaccine recognizes that and tries to keep that virus from infecting your body. Now, one researcher looked at the genetics of that spike protein and said, this looks a lot like a protein that's on the placenta. I wonder if there's some cross-reactivity between the vaccine. And it was really just a researcher's musing that just erupted. And it really gave the anti-vax folks a reason to say, okay, this is why we should not get vaccinated. And it really it took like wildfire across social media. And social media has been really problematic in this whole process. And so I want to talk a little bit about what's happening behind the scenes with social media. A couple months ago, there's a national think tank called the Center on Countering Digital Hate. They looked at all of the social media related to COVID on Facebook, Instagram, and Twitter. And what they did was they took of that information, categorized what's real information versus misinformation. And what they found was that of all of the stuff that would be categorized as misinformation, myths, wrong, intentional, disinformation, 65% of that emanated from 12 accounts. There were 12 people behind all of that. And then through retweets, through shares, it just like took over the internet. And so I share that to say that things like fertility, or this is going to become a part of my DNA, this stuff is strategically and intentionally being put out by people who want to cast doubt and want to cast division, and they're doing a dang good job of it.
Now, can I actually just jump in real quick?
Yeah, Dr.
Let's go back to 2020 in February, March. In the African-American community, for those who are all about conspiracies, we actually had going around that Black folks could not get COVID. Now,
I remember that.
Act like y'all forgot about it. No, I didn't.
Remember that.
Black folks could not get COVID. That turned out to be a doggone lie. So what I'm saying is, for belief and feeling is one thing, but facts are another. And we have to be, as I think Dr. Avula is mentioning, really focused on where the information is coming from and actually being very critical in the context of what information you're really giving it so you can act on. But I just wanted to remind everybody, we've been talking about you can get COVID if you were African-American. It turns out that turned out to be not true.
That's right. I remember when the first reports happened, and the outbreak in China, someone said to me, I was out and about in the community, and he said, well, you see, it's not us, right? It's not us. It's somebody else. It's happening to Asians and the Chinese. It's not happening to us. And I was like, I don't think you're right, brother. And sure enough, a year or so into this, we've seen who's unfortunately paid a disproportionate price, whether it's in hospitalizations or unfortunately death. Now, I want to go back to some of these myths, because one thing that I hear people hanging on to all the time is that this is not a fully FDA-approved vaccine. That they people saying that this is just an experiment. It's EUA, it's an emergency use. What do you say for those who say it's not fully approved, and how can you, why would you even receive something that's approved on an emergency basis?
Dr. Avula, I'm going to let you handle that.
Okay, so where we're at right now, the FDA has authorized these 3 vaccines under what's called an emergency use authorization. The reason the federal government does that is that in times of emergency, and I don't know what context would serve as an emergency more than what we've lived through over the last year and a half, the federal government says, okay, we've got to deploy all of our resources, and we need to get something that works out there when we have a certain level of surety that this is safe. So they did the clinical trials, tens of thousands of people. In the Pfizer trial, there are a little over 30,000. Moderna had about 40,000 people. Johnson & Johnson had 33,000 people who participated in these clinical trials. And when they got to about 6 months, they said, you know what, this is overwhelmingly in favor of safety and effectiveness. And so we are going to grant what's called an emergency use authorization. Thankfully, they did that, because that no doubt has saved hundreds of thousands of lives. What happens next is that in the real world, they look at 6 full months of data, and they go through with a fine-tooth comb, dot every I, cross every T, do all of the statistical analyses, and then they will issue what's called a biologics license. We expect that to happen sometime in the month of September. The FDA has been reviewing all of this data over the last few months. But remember also that we have delivered 350 million doses of these vaccines. The FDA has never had anywhere near that much information to look at and to be assured by. And so I understand the concern about the emergency use nomenclature, but know that we're far beyond that in terms of the amount of information that we have seen and the effectiveness and the safety data that we've seen. And so there's no chance we're not going to move to a full licensure in the next few weeks here.
That's right. Dr. Vula, playing that off of that a little bit, now we have the Delta variant, which is a mutation of the coronavirus, right? It's a mutation of COVID-19. And what I'm hearing from people is that, there's been breakthrough infections for those who have been vaccinated. So I've heard from people saying, well, if you can still get COVID even if you're vaccinated, why should I get vaccinated?
Yeah.
And so how do we, Dr. Nguyen and Dr. Can you explain that? If you can still get COVID, even if you're vaccinated, well, why should I go out and run out and get it?
So I'm gonna break it down real clear. The vaccine, and I'm gonna start off by sort of saying that health is not the absence of any illness. Let's use that as a sign. COVID, the vaccine's supposed to do 3 things really well, but 2 things you want it to do: keep you from dying and keep you from being in the ICU with the ventilator tubes and all the rest of that. To date, it has done exactly with the Pfizer, Moderna, and these vaccines that we've gotten. It has those people who've been vaccinated. It ain't me. The data speaks strongly that 0.0001 of the people who may even remotely be in a hospital have been vaccinated. 99 plus or 90+% of the people in the hospital right now are unvaccinated. Breakthrough. So we're saying that we understood that, these variants come through, the vaccine gets most of it, but you can get breakthrough. What does breakthrough mean? It means, you can test positive for COVID, but you're either asymptomatic or having mild symptoms. Why would you be worried? Because the third leg of the stool, unfortunately, we're on the leading edge of science. Whenever you hear leading edge of science, that means we're all learning together. And we're still all learning together. We wanted the third leg of the stool to be that not only would we not wind up in a hospital, not only would we not wind up dead, but we wouldn't wind up being able to pass to the other people. Turns out that 2 of the 3 legs are solid as all get out. That last leg of being able to transmit it to other people is turning out to not be as strong, but certainly stronger than if you haven't had any vaccine. And that's just life. The one nice thing about it is that people want perfection. Ain't nobody up on the line perfected. And yet you want things to be perfect with no bumps in the road. Well, it ain't life. But here's what I guarantee you. That vaccine, every day now, when we're in the ICU, people who are vaccinated ain't coming in my ICUs. They're not coming in the hospitals and they're not dying. That is what the COVID-19 vaccine is supposed to do. And honestly, it's doing its job. So when people worry about breakthrough, you can either worry about breakthrough or worry about death. I'd rather worry about breakthrough. But again, I'm just a little country boy, just trying to do a little something like that. But that makes no logical sense to me that we'd be arguing about breakthrough versus death.
That's right. And Dr. Vula, I personally had COVID, but I've heard from other people who said, I have had COVID, so why do I still need to get vaccinated?
So when people get COVID, they do develop some degree of immunity, right? Your immune system does its job. It builds antibodies, it builds its defenses. But what we have seen consistently in the data and all of the studies that have been done since we started vaccinating is that the degree of protection you get from vaccine far outweighs natural immunity. And in fact, there's kind of a multiplicative effect. So if you've had COVID and then you get vaccinated on top of that, or vice versa, that really seems to rev up your immune system, rev up your defenses even more. I think it's also particularly important in the context of the Delta variant. So we've talked about variants. Viruses by nature are going to mutate. They're trying to survive. They're trying to propagate. So we're going to see more and more variants come along. Hopefully they won't be as contagious as this Delta variant is, but they might be. And so we want to make sure that people have the highest level of protection they possibly can have, and that's not going to come through natural immunity. It's going to come through the vaccine.
Now, Dr. Avula, the Delta variant is the dominant strain of the virus today. There will likely be more variants as well. Will the vaccine protect me against these variants?
So far, they have. The Delta variant has been kind of the fourth major variant. Remember the UK variant, South African variant, the Brazilian variant, and now this Indian variant. So alpha, beta, gamma, and delta. So we will undoubtedly see more variants. And thankfully, this vaccine has been incredibly effective against all of them. We see a little bit of a lessening effect with this Delta variant where it's not as protective for you getting it, which is why we're seeing all these breakthrough infections. But as Dr. Wynn said, it is absolutely effective in preventing against hospitalization and death. So our hope is that it will continue to hold up against future variants. I can't guarantee it. And what I do think is a likely part of our reality moving forward is that that researchers will start to make new formulations of the vaccine that have the predominant strains in it. Just like the flu shot every year is a little bit different. We have different strains of the flu. So we get a new formulation of the flu shot. That's going to be our life with COVID moving forward, I think.
And I'm going to get a little bit of basic science up in here and saying medicines are part of this, but we are all of it. And what I mean by that is, had most of us actually gotten by July in the United States, 70% of us had been vaccinated, we wouldn't be worrying about variants.
That's right.
Variants start in large populations of unvaccinated people. So if we were all hanging tight, and if we could all go through the replay and had gotten that 70+% of vaccination, we probably wouldn't be talking about this Delta variant. You know, there are people on the globe right now ain't worried about no Delta because the vast majority of their population was vaccinated. So we need to stop playing that. This also is incumbent upon human behavior in the context of our taking care of one another and being serious enough with it and getting the vaccine.
So Dr. Wynn, fast forward real quick. I'm a city employee. I get the shot. I roll up my sleeve. I do what you asked me to do. Am I going to see some adverse side effects? What should I expect if I get vaccinated?
I think we're going to double team this. Here's what I'm going to say, that you will see reactions to it. And that is not a reaction, is not an adverse event. Losing a leg is an adverse event. Having a stroke is an adverse event. Having a heart attack would be an adverse event. Feeling like you got a little flu symptoms is not an adverse event. That is called the reaction. That is your body reacting and building the fighters, the antibodies to fight off the COVID. So you'll get a little sore arm. You know, sometimes you'll feel like you're a little under the weather. You'll be tired. You know, you'll feel a little flu-like, sleepy, and then, you know, some other symptoms like that. But that it comes with the package of getting almost any of these vaccines, including the flu vaccine, to be quite honest with you. So it ain't like we are not used to it. And I know that city employees, I would hope, are getting the flu vaccine. And some people complain about the same thing. Oh, I get a little headache. I get, maybe not the soreness in your arm, but I feel like I got flu. So if you ain't got the flu, just your body getting prepped and ready, right? But there are adverse effects, and that have been associated with some of the trials. They're ridiculously rare cardiomyopathies, all the rest of these things. In fact, we were talking about teenagers, and remember the young men they were getting, and they were having, quote, cardiomyopathy. None of them died. It was all treatable. But I have heard of a 16-year-old and now a 24-year-old who have died from COVID because they've been unvaccinated. That's just the reality.
That's right. We had a 17-year-old in Norfolk, I believe, who died just recently. The first child to die in Southeast Virginia. So to me, that's scary enough. Dr. Avula, do you want to just pitch in on that one?
What would I add? I mean, I think I want to reiterate what Dr. Wynn said, that when a lot of people, the majority of people will have some mild symptoms, but that is your immune system doing exactly what we want it to do. And so when you feel that achiness, when you feel that soreness, when you feel a little bit of fever, know that your immune system is revving up to protect you against the next time that you're actually, exposed to COVID. So that's normal. It's expected. And it's, we will see that. Now, let's talk a little bit about the myocarditis. I've had a lot of questions from parents in particular because we saw slightly higher rates with young adolescent or young adult men. And myocarditis is a rare inflammation of the heart, and we saw a little bit of an increased signal with that with the 2-dose vaccines, with Pfizer and with Moderna in younger men ages 12 to 29. In all of those cases where people developed that heart inflammation, it was really mild. Nobody died. And almost all of them didn't even require any kind of treatment or intervention. It just got better on its own. You are 100 times more likely to develop more severe myocarditis if you actually get COVID. So myocarditis, yes, is a rare side effect of the vaccine, but is a much more common complication if you're infected with COVID. One other thing that the Advisory Committee on Immunization Practice did is they wanted to put it in kind of palpable terms to say, how rare is this? And what's the risk and benefit? Because there's always going to be a risk and benefit analysis. And so they said, they looked at all of the data and they said, if we vaccinate fully 1 million people with this 2-dose vaccine, we will see somewhere between 30 to 40 cases of this myocarditis. It's going to be mild. It's going to get better on its own. We will prevent 12,000 cases of COVID, 500 hospital admissions, 120 intensive care unit admissions, and somewhere between 6 and 9 deaths. And so in the balance, yes, there's a risk of some mild symptoms that will get better on their own, very rare, but there's an incredible benefit to the individual, but also to the community.
That's right. As we wrap up, I know Dr. Wynn and Dr. Will, you all have to go because you all are doctors, so y'all are always busy. Real quick, resources for city employees if they want to find out more about the vaccine.
Well, I would point you all to the City Health Department website, rchd.com. There are a number of different FAQs, one-pagers that really talk through myths. We also, on the Virginia Department of Health website, which you can link through rchd.com, there are a number of other resources, again, with links to the CDC as well. So there's so much information out there. Certainly for all of you city employees, the health department exists here to support you all. So please don't hesitate to reach out either through your supervisor to get in touch with our team at the health department. We'd be happy to answer any questions or do more Q&A sessions just like this one.
Thanks,
Dr. Wynn? I would just sort of say all your physicians and all the healthcare providers are keeping ourselves healthy so that we can take care of you all when you get sick. So please, we're counting on you to be healthy, to take care of the business of the city and everything else so that we're working as one team, one fight, and that's just getting through COVID. My folk and many people like me in the ICUs and other places are literally rolling up our sleeves, getting the shot to make sure that when you or someone from your family gets sick, or they need to be intubated, or they need to be taken care of, we're right there for them. I can't do that if I'm unvaxxed. And you can't do your job if you're unvaxxed. So let's just, one team, one fight, hanging this together. Let's take care of one another and we'll get through this.
Dr. Nguyen, Dr. Avula, I really appreciate you. I appreciate both of you throughout this whole pandemic. You all have been the voice of reason for the city and have been our biggest champions in ensuring that we have a safe and healthy city moving forward. So I want to thank you all for your time today. And to the city employees out there, I want to thank you for tuning in as well. Remember, August 12th, 9 a.m. to 4 p.m., we'll have a vaccine event here at City Hall in the old Pat House location. And on August 17th, if you're part of Department of Public Works or DEC or any of the departments off the Hopkins Road site, there will be a vaccination event there from 1 to 4 p.m. Thank you all so much. And I hope that if you have any questions, to please reach out to our office. Take care and thank you.
Thank you, Mayor. Take care.
Thank you.
Thank you, man. Appreciate it.